Hello everyone, welcome to my YouTube channel, that is Decoding First Aid. I'm Dr. Shrinkla and I've secured rank 629 in NEETPG 2023. So, today what we are going to decode is collagen synthesis disorders. We have already started collagen types and synthesis, pathway of collagen formation in the previous video, that is the part 1 of this video. So, if you have not seen that video yet, do check the link in the description box for the part 1. In this video, we are going to talk about, we are going to study together, that is, this collagen synthesis disorders, osteogenesis imperfecta, Menkes disease, Ehlers syndrome separately. Because these questions are asked from this, right? So, yeah. Let's first talk about osteogenesis imperfecta. This is examiner's favorite question. They integrate it, like they give it in the clinical vignette के फॉर्म में, ठीक है? तो या तो फिर उनसे वो पूछेंगे टाइप ऑफ जीन कौन सा इन्वॉल्व है, या तो पूछ लेंगे उनके क्लिनिकल फीचर्स के फॉर्म में, व्हाट ऑल क्लिनिकल फीचर्स विल बी गिवन, या फिर पूछ लेंगे उनका ट्रीटमेंट, या फिर दे कैन आस्क इट इन डिफरेंट फॉर्म्स, लाइक रेडियोलॉजी के बेसिस पे भी. सो इट्स अ वेरी इंटीग्रेटेड टॉपिक दे कैन आस्क क्वेश्चन फ्रॉम, राइट? सो लेट्स स्टडी इट. सी, ऑस्टियोजेनेसिस इम्परफेक्टा को और क्या बोलते हैं? यस, यू माइट बी नोइंग इट. इट इज brittle bone disease. Why? Because bones are brittle here, that is fragile here. ठीक है? इसमें क्या होता है osteogenesis imperfecta में? It's a genetic bone disorder. ठीक है? Bone disorder है, लेकिन problem osteoblast में, क्या osteoclast में? Yes. The problem is in osteoblast. So it's a osteoblastic problem. And what does osteoblast has? Yes, it's a type 1 collagen, right? So actually क्या हो रहा है osteogenesis imperfecta में, the most common form of the osteogenesis imperfecta में, ठीक है, there's a decreased production of otherwise normal type 1 collagen. ठीक है, तो osteoblast फिर नहीं काम करेगा and therefore the bones which are formed here will be fragile. ठीक है, अब see, we have already talked about it. This was our synthesis pathway, correct? तो सिंथेसिस पाथवे में यू कैन सी कि ऑस्टियोजेनेसिस इम्परफेक्टा कब हो रहा था? जब ट्रिपल हेलिक्स फॉर्मेशन नहीं हो रहा था. ट्रिपल हेलिक्स फॉर्मेशन नहीं होगा तो क्या होगा? यस, तो फिर कोलाजन डिफेक्ट होगा, कि कोलाजन सिंथेसिस विल गेट डिस्टर्बटेड. यस, अब इसमें याद जो हमको रखना है वो है जीन्स. ठीक है, वेराइटी ऑफ जीन्स डिफेक्ट्स कैन कॉज दिस ऑस्टियोजेनेसिस इम्परफेक्टा, बट द मोस्ट कॉमन दैट यू हैव टू रिमेंबर इज COL1A1, दैट इज टाइप 1 कोलाजन में, और COL1A2, ये याद रखना है. और उसका मोस्ट कॉमन फॉर्म जो रहता है वो भी कौन सा है? ऑटोसोमल डोमिनेंट. सो दिस आर द क्वेश्चंस दे आस्क. अब दिस आर, ठीक है, वन लाइनर्स दे आस्क यू. ठीक है, जीन के बारे में पूछ लिया उन्होंने, फॉर्म पूछ लिया, क्या हो रहा है, ऑल्टर ट्रिपल हेलिक्स याद कर लिया. ठीक है, ये सब हो गया. लेकिन अब क्लिनिकल विन्याट कैसा आता है? आई टेल यू 2 टाइप्स ऑफ क्वेश्चंस, एक क्लिनिकल विन्याट या फिर रेडियोलॉजी के फॉर्म में जो पूछते हैं. क्लिनिकल विन्याट कैसे देंगे? दिल गिव यू प्री स्कूल चिल्ड्रन 3 to 4 years, 2 years, जो भी है, they'll be brought by the parents and they'll have complaint of multiple bone fractures that will be present in different stages of healing. Okay, along with that, see, I'll write it down for you, right? Clinical vignette, how it will come, how they'll integrate different aspects of it. So there will be a preschool child, okay, complain of multiple bone fractures, but on examination, on X-ray, whatever, you'll find this. Okay, different stages of healing. On the top of it, when you examine the patient eye, you'll see blue sclera. If they're giving you this combination, then whoa, you are osteogenesis imperfecta case. You have this case, right? So you've decoded it. Along with, on the top of it, if they give you dental abnormalities, then it is nothing but osteogenesis imperfecta. Correct? See, why this is happening, why this clinical features, I'll tell you. Because type 1 collagen decrease production. ठीक है, तो type 1 collagen का production decrease है. type 1 कहाँ पे होता है? You have bone, you have tendons, ठीक है, you have it in dentin, ठीक है, you have it, the sclera will be thinned out. So the bluish hue of the choroidal vessels will be visible. That is the reason you have blue sclera. You can remember this by simple mnemonic, that is bite. Okay. Bite में क्या होता है? B is for bones, multiple bone fracture. You have I for blue sclera. You can see this. This is a classical picture that they'll show you if they want to give this clinical vignette. Blue sclera will be present in other cases also. So if we have this 2 combination, this 3 to 4 combination, then you should think about osteogenesis imperfecta. Okay, teeth, because dentin is present, dental imperfections. E is for hearing loss, ear, So this is what the clinical features are, right? Multiple fracture, bone deformities. See, in this case, if you see this X-ray, fracture is not shown over here. But what is shown is bone deformities. Because bone are fragile, no? So if this X-ray is also given, then also you should think about it. Correct. Other things, blue sclera, bite ka B, bite ka I, obviously. Then you should have tooth abnormalities, dentogenesis, imperfecta bolte हैं. And what happens? Bone to ossicles can be affected. So abnormal ossicles, that will result in what kind of hearing loss? Yes, it will be conductive hearing loss that will be present. This is the classical things that will be present, and obviously you should always think about osteogenesis imperfecta in this scenario. Correct. Now, one thing that the people and the examiner will try to confuse you with, you will always think about it, multiple bone fracture हो रहा है, child abuse भी तो हो सकता है. Yes. So how to differentiate it with the child abuse? You have to differentiate it by C. That is, what is child abuse known as? It is battered baby syndrome. Correct. Battered baby syndrome. That is child abuse. What along with multiple fracture will be present? See, multiple fractures will be there in both the cases in different stages of healing. Okay. But along with that, you'll also have other signs of abuse. Like cigarette mark can be there. You'll always be suspicious about it, right? Contusion will be there. Okay. The abnormal behavior, the history will not correlate with the clinical examination. These all things will go and you'll have suspicion towards abuse. Along with that, one thing that is important is a fracture. In this case, it will be metaphyseal fracture. Okay, that is also known as corner fracture. Whereas, in case of osteogenesis imperfecta, kind of fracture we have, this is diphyseal fracture. शाफ्ट में होता है, यहाँ पे कॉर्नर में होता है, और यूजुअली किस में होता है? इसमें डिस्टल, अल्ला एंड रेडियस. प्रोटेक्ट करने के टाइम पे जो प्रोटेक्शन वाला होता है ना, उस टाइम पे होता है डिस्टल, अल्ला, रेडियस, ऐसे टाइप के. ठीक है. So this was it. One last thing. Yes. How will you treat this patients and what will you give for the treatment? So I remember it how? See, I remember it by 2 B's. First B for braces. Braces is to prevent further deformity. Correct. And second B is for bisphosphonates. Bisphosphonates will prevent the risk of fractures. It will decrease the risk of fractures. Okay. Sorry. So these 2 things you should remember. Okay. I guess this was it about osteogenesis imperfecta. Let's move towards second disorder, that is Ehlers-Danlos. Ehlers-Danlos, actually same. It is also in Ehlers-Danlos also we have defective and faulty collagen synthesis. Okay, variety of genes will be involved again in this. But what you should always remember about Ehlers-Danlos are these 2 pictures. See, what are you showing? What is shown in this picture? The first picture is skin, right? You're stretching it. Like, if you stretch your skin like this, will it be stretched to this limit? No. This is hyper extensible skin. Correct. And the second picture shows you joint is hypermobile. This is hypermobile joint. Our joint does not move like this to this extent. So, these 2 features, the specular features, will indicate towards Ehlers-Danlos syndrome. And in fact, hypermobile joint is something that you'll also see in other disorders. Marfan's में भी दिखता है, ठीक है, फ्रेजाइल एक्स सिंड्रोम में दिखता है, बट हाइपर एक्सटेंसिबल स्किन बोल रहा है, तो यू शुड थिंक अबाउट एहलर-डायनोस. Let's talk about the type. Okay, first the features. We have started hyperextensible skin, hypermobile joint, along with easy bruising, tendency to bleed. Because blood vessels are fragile, blood walls are weak, so they'll bleed easily, right? So let's study the type 1, the types of it. So first one is hypermobility type. You can remember, it is the most common type. Okay, only joint instability, joint hypermobility will be present. Type 2, not the type 2 actually, it is a classical type that you should remember. It is joint, along with joint, you have hyperextensible skin also. Here you should remember is collagen का type. It's a type 5 collagen. So कैसे होता है? Type 5 है, तो col 5 होगा. Col 5 A1 and A2. अब जो important है वो है vascular type. जब हम कोलाजन सिंथेसिस पढ़ रहे थे, उसके टाइप्स पढ़ रहे थे, तब हमने पढ़ा था कि टाइप 3 जो रहता है उसमें डिफेक्ट होता है, तो वास्कुलर टाइप ऑफ एहलर-डायनोस होता है. रिमेंबर? यस. सो क्या होता है, टाइप 3 कोलाजन कहाँ कहाँ पे होता है हमने पढ़ा था. इट इज़ प्रेजेंट इन यूट्रस, इंटेस्टाइन, ब्लड वेसल्स. तो अगर टाइप 3 कोलाजन डिफेक्टिव है तो ये सारे दिस वेसल्स, दिस टिश्यूज, दे विल बी फ्रेजाइल, करेक्ट. सो द टिश्यूज विल हैव रिस्क ऑफ रप्चर, राइट. So there will be uterus rupture, intestine rupture, blood vessels will be fragile. So you can easily have this. They'll also be having the tendency to bleed. This is what happens in Ehlers-Danlos syndrome. Yes. See, fragile tissues. We have fragile tissues. Okay. And organs, there will be a risk of rupture, right? This is what we are talking about, vascular type. It is not a very common type, but these are the features which are peculiar to it. Okay, you should remember one thing, that is, it is because of the mutation in col 3A1. We have already studied, right? Type 3 collagen is there, so there will be defective type 3 collagen. Okay, this blood vessels, since they will be fragile, the walls will be weak, so we'll also have aortic aneurysm. The patient will also have this, and Berry's aneurysm. Okay, this blood vessels will be affected, no? The walls will be weak, then balloon out, resulting in aneurysm. This was it about Ehlers-Danlos syndrome. The next. When you study Berry's aneurysm, no, one of the causes of Berry's aneurysm is Ehlers-Danlos syndrome also. There are other causes too. The last one that we'll be studying about is Menkes disease. Okay, so Menkes disease is also a connective tissue disorder. Menkes में क्या आ रहा है? Men लिखा है, मतलब male are more affected than females, and that is the reason it is an X-linked recessive connective tissue disease. You can remember it like men मतलब male affected, male किसमें affected होते हैं? X-linked recessive disorders में affected होते हैं. ठीक है? होता है क्या Menkes disease में? Let's go through this diagram. Okay. There are two types of protein that we have, ATP7A and ATP7B. Both are required in the copper transport, but in different locations of our body. Okay. ATP7A is the protein which is required for the copper absorption and transport into the blood vessels. Okay, in the GI lumen, from the GI lumen. The diet में जो हम copper लेंगे, उसका एब्जॉर्प्शन और उसका ट्रांसपोर्ट इन द ब्लड वेसल्स, उसके लिए चाहिए हमको ATP7A. बट जो ATP7B होता है, ठीक है, दैट इज रिक्वायर्ड फॉर द कॉपर ट्रांसपोर्ट आउट ऑफ द हेपेटोसाइट्स, राइट, एंड सो दैट इट कैन बी एक्सक्रीटेड इनटू द बाइल. ओके, सो इफ these two proteins are defective, so this is the case of Menkes. Let me write it down for you. And this is the case of, yes, Wilson's disease. तो Menkes में क्या डिफेक्टिव है? ATP7A, ठीक है, और दिस इज ATP7A. और तुम्हारे विल्सन्स में क्या डिफेक्टिव है? ATP7B, ठीक है. तो Menkes में क्या होगा? डिक्रीज्ड कॉपर लेवल, बॉडी में कॉपर का लेवल कम होगा. बट विल्सन्स में क्या हो रहा है, बिकॉज कॉपर को हम एक्सक्रीट नहीं कर पा रहे हैं बाइल में, तो कॉपर विल एक्यूमुलेट इन द हेपेटोसाइट्स एंड विच एक्सप्लेन्स द क्लिनिकल फीचर्स ऑफ दिस विल्सन्स डिजीज. सो कॉपर लेवल विल बी इंक्रीज्ड. दिस आर द 2 बेसिक फीचर्स अबाउट दिस, राइट. तो हम पहले पढ़ते हैं. लेट्स कम बैक टू मेंकेस लॉ. ओके, सो मेंकेस में क्या हो रहा था, ATP7A प्रोटीन है वो डिफेक्टिव है, तो उसकी वजह से क्या होता है, कॉपर का एब्जॉर्प्शन और ट्रांसपोर्ट नहीं होगा कट में, करेक्ट. एंड अब हमको पता है ना कि कॉपर वाज रिक्वायर्ड फॉर विच एंजाइम ऑफ कोलाजन सिंथेसिस के, कौन से एंजाइम के लिए, यस, लाइसिल ऑक्सीडेज सी, दिस एंजाइम लाइसिल ऑक्सीडेज. अगर कॉपर की डिफिशिएंसी है मैंगेज में तो लाइसिल ऑक्सीडेज काम नहीं करेगा, तो क्रॉस लिंकिंग नहीं होगी, तो कोलाजन विल बी डिफेक्टिव. यस, सो दिस इज व्हाट हैपेंस इन दिस. मैंगेज में क्या हो रहा है, आई राइट इट डाउन फॉर यू. ठीक है, डिक्रीज्ड कॉपर दैट विल रिजल्ट इन बिकॉज ऑफ ATP7A, okay, defect. This enzyme will be defective, copper absorption and transport will be defective. ठीक है, so copper की deficiency होगी, that will result in decreased activity of lysyl oxidase enzyme, okay, and that will result in no cross linking, so there will be a faulty collagen, that will be a collagen defect. Yes, so there's a collagen defect. So what are places that have collagen, that will be there will be symptoms over there, right? But the important thing that you should remember, और इसका ये फीचर जो हमेशा याद रखना है, जो सिर्फ ये इंडिकेट करता है, वो है किंकी हाइपोपिगमेंटेड टॉर्चस हेयर्स, राइट, किंकी हेयर ग्रोथ. ओके, और भी फीचर्स है, डेवलपमेंटल डिले, हाइपोटोनिया, इंक्रीज रिस्क ऑफ सेलुलर एलिज्म, बट सबसे इम्पोर्टेंट जो है, जो यही जिससे तुम यही सोचोगे, दैट इज किंकी हेयर. ओके, दिस वाज इट अबाउट collagen synthesis disorders. This was a part 2 of it. I hope you enjoyed it. Thank you so much for watching. And if you like this video, please like and comment on which all other topics you want me to make video on. I'll make it in a very super easy way so that you can understand from scratch to the level where you can solve MCQ questions. This was it. Thank you so much.